Hello, and welcome back to Induce with Care, where we dive into all things related to labor, birth, and induction. I'm Nikki, and today we're jumping into a question that I know a lot of you have asked. Can I refuse an induction? And the answer to that is yes. Yes, you can. Good night, everyone. Thanks for watching. Okay, there's a little bit more to it than that. When your provider suggests an induction, it can feel like a curveball. And you're probably thinking, well, do I have to go along with it? Well, spoiler alert, no, you don't. You have the right to refuse any medical procedure, including an induction. But there's more to the story than a simple yes or no. So in today's episode, we'll break down when and why inductions are recommended, what you should think about before refusing, and how you can advocate for your choices while ensuring a safe outcome for you and your baby. So first things first, why do doctors even recommend inductions in the first place? Is it really necessary? Well, induction isn't something that's done on a whim. In most cases, it's recommended when staying pregnant might pose a bigger risk than delivering your baby. But not every situation calls for it. Let's quickly walk through some of the most common medical reasons for induction, and I know I've discussed this before if you watch my channel. Post-term pregnancy. So once you hit that 41, 42-week mark, your provider might suggest an induction. Why? Because after this point, the placenta starts deteriorating and the risk of complications like stillbirth go up. Preeclampsia and gestational hypertension. High blood pressure conditions like preeclampsia can put both you and the baby at serious risk. And we're talking about seizures, stroke, and other very scary complications. So in these cases, inductions can prevent things from escalating. And FYI, if you have these conditions and it gets worse and you don't induce, your risk of having an emergency cesarean increase exponentially. Gestational diabetes. So if gestational diabetes is poorly controlled, your baby can grow larger than normal, which can make delivery more complicated. So to avoid issues like a shoulder dystocia or a C-section, induction is often recommended before the due date. Premature rupture of membranes. If your water breaks and labor doesn't kick in naturally within 24 hours, there's a higher risk of infection for both you and the baby. So induction is recommended in this case to move things along to avoid that. Fetal growth concerns. If your baby isn't growing properly or your provider is concerned about their well-being, induction may be suggested to get the baby out safely. So now those are the main reasons for induction, but here's the part where you may be thinking, okay, I get it, but can I still say no if I'm not ready to go down that path? And well, you can, but let's talk about it first. All right, here's the million-dollar question. Can I refuse an induction? And the short answer is yes, you absolutely can. Informed consent means you have the right to decide what happens to your body. Your provider can recommend an induction, but they can't force you into it. But let's break this down. Informed consent means your provider explains the risks, benefits, and alternatives to a procedure like an induction. You get to ask all the questions you want and make sure that you understand what's being suggested. Then, and here's the kicker, you still get to decide whether or not to accept or decline. Now, why might you consider refusing an induction? Well, for one, you want to avoid unnecessary interventions. So if everything is progressing normally and you're being offered an elective induction, you might decide to wait for labor to start on its own. You're concerned about the risks. Induction can sometimes increase the likelihood of certain interventions like epidurals, forceps, or even C-sections. So if you're trying to avoid those, you might prefer to let nature take its course. You're just not ready yet. Maybe the timing just doesn't feel right for you, and if both you and your baby are healthy, waiting a little longer could be a comfortable option. But refusing an induction isn't as simple as just saying no. It's about understanding the risk of waiting. That's where things get a little trickier, and we'll dive into that next. Now let's talk about a really helpful tool that can help guide you through this decision-making process, the BRAIN acronym. So how do you make the best decision when faced with the option of an induction? One really helpful tool that I love is the BRAIN acronym. It's a quick way to remind yourself of the questions that you should be asking when making an informed decision. Let's break that down. So B is for benefits. Ask, what are the benefits of inducing labor? Will it reduce the risk for you or the baby? Will it lead to a safer delivery? R is for risks. Next, ask about the risks. What are the risks of inducing labor? You'll want to know if it increases the chance of a C-section or other complications. A is for alternatives. Always ask, what are my alternatives? Maybe there are other options like waiting for labor to start naturally or monitoring the baby a little more closely for a few days. I is for intuition. This is key. Trust your gut. Ask yourself, what does my intuition say about this? Sometimes your instincts are your best guide. And lastly, N is for nothing. What happens if we do nothing? Sometimes doing nothing and waiting is an option. So, what are the risks of just letting things progress on their own? By using brain, you can feel more in control of your whole birth process. Now that you've got brain on the brain to help you guide your decisions, let's talk about how you can advocate for your birth preferences, whether you decide to go ahead with the induction or not. So, here's how you can stay in the driver's seat. Ask the right questions. Don't be afraid to ask for more details. Try questions like, what's the specific medical reason for recommending an induction right now? Are there alternatives to an induction like monitoring or waiting a little longer? What happens if I decline and wait for natural labor? And take your time. Unless it's an emergency, you have time to think about it. Don't feel pressured to make a snap decision. Find a compromise. Sometimes there's room to negotiate. Can you monitor things closely for a few more days? Maybe your provider can check in with more frequent ultrasounds or non-stress tests while you wait. Have a birth plan, but stay flexible. And I get it, having a birth plan is empowering. But you always have to be ready to roll with the punches. Things can change quickly, and being flexible is key to a positive experience. At the end of the day, it's about balancing what you want with what's safest for you and the baby. Don't forget, your providers are part of the team. They're not the bad guys. And here's something important. Trust your provider. Or should I say, make sure you have a provider that you trust. Labor and delivery can be unpredictable, and the trust you build with your healthcare team will help you through these tough decisions. If you feel good about your provider's recommendations, it can ease a lot of your anxiety. But, and this is important, if you ever feel pressured or uncomfortable, it's 100% okay to seek a second opinion. Your peace of mind matters, and you deserve to feel good about your choices. All right, that wraps up today's episode on whether or not you can refuse an induction. Remember, it's important to weigh the pros and cons carefully. By advocating for yourself, asking the right questions, and trusting your instincts and your provider, you can make an informed decision that feels right for you. Thanks for tuning in to Induce with Care. If you found this episode helpful, don't forget to like, subscribe, and share it with anyone who might be navigating these decisions. And as always, leave a comment below with your questions or stories. I'd love to hear from you. Until next time, take care.